Hi, this is Dr. Jagdeesh Kulkarni. I am a Director of Minimally Invasive Surgery at Asian Cancer Institute and also a Professor of GU and GYN Oncology. Well, today I talk to you about the impact of robotic surgery in surgical oncology. The robotic surgery actually started all over the world in 2000, that is exactly 20 years ago. However, the project was conceived by NASA, and this was approved by NASA for battlefield soldiers who are there to be treated. It took about 20 years before this robotic surgery could be developed into human beings. And there are two companies, which Zeiss and Da Vinci, merged together and formed the first Da Vinci or first robotic platform in about 2000. From then on, there has been a great journey of robotics, and multiple countries have started accepting robotic as a primary treatment in many instances. Having said that, today in US, we have got large number of robotic centers, so also in Europe. In India, it came in about 2006. However, real jump came into 2010 onwards, and as it stands today in 2019, toward the end of the year, we have got 100 robotic platforms all over the India. Not only that, there are also, in about 2 years' time, we will have multiple companies who will be pitching into the robotic surgery platform with different advantages at this thing. Now, what is robot? Actually, robot is based on a master and slave sort of a principle. It is the master, which is a surgeon, who asks the slave, that is robot, to perform the activity. Now, what are the advantages for robot? Of course, there are 5 distinct advantages. One is magnification to the tenfold. The blood loss is minimal in surgery. Pain is reduced. The requirement of painkillers is reduced. Also, the return to the activity is very fast. Patient can be discharged and hospital stay reduced completely. Plus, if patient requires any additional treatment, which can be started at the earliest, so that because patient's recovery is very fast. Now, the major impact of robotic surgery in first 5 years was in urological cancers, and then came on gynecological cancer. Most important operation was radical prostatectomy, which we have been doing in open way. In India, I had a first chance to do robotic surgery in 2011 when the robotic program started at our institute. From then on, we have done over 1,000 cases now. In last 10 years, we have not only covered genitourinary cancers and gynecological cancer, but we have also gone on to thoracic surgery and head and neck surgery, as well as gastroenterological surgery. Now, of interest is the patients whom we are now finding there are more than one primary sites. Say, for instance, patient comes for a diagnosis of a carcinoma stomach and has an incidental finding of a kidney tumor, or for that matter in females, breast cancer and an incidental finding of a renal tumor. Now, these two operations can be done simultaneously in the same go, with the result that both operations are done in one sitting and the patient's recovery is fast. And in either instance, if some of the other cancer requires urgent treatment, it can be started. So, therefore, the advantage of robotics is also for multiple primaries, also reoperations. And we have got a very good examples of patients who had first surgery as open surgery, and then we did a robotic surgery for a relapse. So, that is also an important issue. Thirdly, and which is important, is that when we are doing redo surgeries, the morbidity or trouble to the patient is minimal, and again his quality of life improves very fast because he recovered immediately. Now, what happens, the questions are asked to us is, most of the time there are some myths in robotic surgery. Patients start feeling as if the robot is operating, and my humble suggestion to them or request to them is that it is not the robot, it is the surgeon who operates with the extended hand, which is a robotic hand. So therefore, every decision is made by the master, which is surgeon, and the slave, which is the robot. So that's where it is. Now, what are the nuances which are likely to occur in about 2 to 5 years? And that is what artificial intelligence, where newer companies are going to come back with the robots which have got an AI in them, where once a surgeon performs a procedure in a manner, and if he deviates from there, which may have to have during some of the patients, because every patient is not the same, in that case, the artificial intelligence will tell you, well, last time you did this way, so go back to that, or you will have to again modify that. So this is one more addition which is going to come in artificial intelligence to be incorporated in the robot. Now, what is the next? Next is also the anatomy, which I saw when I was doing robotic surgery, and the anatomy which I learned during open surgery is far more different. So my feeling is that even anatomy can be taught when you are doing a robotic surgery to the all undergrads, and this must percolate to the undergraduate medical education as well. Now, the other thing which of course is most of the companies are continuing with newer generations like a mobile phone technology. You know, there were huge mobile phones which have come so small. So where ultimately the progress is going to happen. So multiple generations of robots are going to come, but the cost should be levied it should not be levied for multiple. And lastly, which is the more important, is if we were to get into telementoring, which is very much possible, then we might also go in for a transplanetary surgery as well. So that's going to be there. So at the end, I can only sum up and say that, well, we are in exciting times in the world, with impact of technology and remote control surgeries, which is called a telementoring. And then we will be in about next decade or so, you will see all these changes. With this, robotic surgery has come to stay. Of course, the last question which I have to answer is that, is open surgery gone? No, open surgery will still remain, because there will be some patients who are not fit for robotic surgery. So open surgery will still remain. And our journey to betterment of technological use in surgical practice will continue. Thank you very much.